where's our association? Where's the APIC for healthcare disaster preparedness? And everybody just kept telling me, I don't know, Kristi. Stop. Eventually, I complained enough and I peppered Keith enough that he finally said, okay, let's make this happen. Like, let's do this, because it's clearly not there. People need it.
Hi, everybody. This is Chris, and welcome to Readiness Rewired. Hey, Al, what time is it?
Chris, I looked at the clock recently, and it's time for another podcast of Readiness Rewired, a healthcare preparedness podcast. So let's get rolling, buddy.
Awesome. Mike, are you on?
Hey, I'm here with bells on, man, and we've got all the electronics going, and we've got a beautiful day to do a podcast. So launch it, man.
And some great guests, I believe. So, Al, would you like to do some introductions, and then we can jump right in with some conversation?
Absolutely. We got two really, really good guests, friends of ours from AHEPP, which is the Association of Healthcare Preparedness and Emergency Preparedness Professionals. Wow, I got to get that out. So it's the Association of Healthcare Emergency Preparedness Professionals. We've got Kristi Sanger, who is co-executive director of AHEPP, and she's also project coordinator and educator for the Center for Preparedness and Response Solutions at the College of Public Health at the University of Nebraska Medical Center. And also with her, we have Keith Hansen, and Keith is also co-executive director of AHEPP, and he's the director at the Center for Preparedness and Emergency Response Solutions and an instructor at the college as well. So, hey, guys and gals, welcome. We're really excited to have you. And I know with Chris and I have had a lot of exposure with AHEPP and interactions, and been at your annual conference. And we're excited to have you on and talk about some things happening at AHEPP and maybe some projections for you. So why don't you two kind of tell us a little bit about just AHEPP in general for all our listeners out there, so they can understand how to get involved.
Okay. Well, thanks, Al. We've met a long time ago, and we have been fast friends ever since, I think. It was all through AHEPP and through some of your work in Iowa. And AHEPP we started in 2014, the end of 2014. Probably December, so bitter end. We started the association because we wanted to have a place for healthcare emergency managers to go and find their peers and find the education they need, and really help them do their job well. We looked around. I started in this world from infection control a long time ago, and my association was APIC, and those were the folks that I went to on a daily, weekly, monthly basis to find whatever it was I needed to do my job. I didn't know the world of infection control very well at the time. And I know that kind of sounds familiar for disaster preparedness professionals too, right? We kind of get thrown in as other duties as assigned, and here you go, this is your job. I know you know nothing about it, figure it out. And so that was one of those things that, I turned to APIC every single time I had a question. I found my peers that way. I found my help that way. And I continually looked for that in this world of healthcare disaster preparedness, and I couldn't find it. And I kept asking. I was kind of peppering Keith and all of our peers that worked at the college. Where's our association? Where's the APIC for healthcare disaster preparedness? And everybody just kept telling me, I don't know, Kristi.
Yeah.
Stop bugging
Basically,
me.
our response was "shut up and color" is really what we said
Yeah.
when she first brought that
Yeah,
up.
not too far off. But eventually, I complained enough, and I peppered Keith enough that he finally said, "Okay, let's make this happen. Like let's do this because it's clearly not there. People need it." We were running into more and more people that we were helping in Nebraska because our center at the time was grant funded to help educate and assist the folks that were in preparedness in Nebraska. And we continually were getting calls from other states. Can you help us with this? We heard you have a program. We heard you to have this. We heard you're educating on that. And finally, we said, you know what? We can't do this through Nebraska grant program. So we have to do this separately. And so that's where AHEPP was born. Keith,
Hey,
did you have
Kristi.
anything to add? Oh,
Well,
yeah.
just I sometimes play the role of the acronym police. Could you tell us what APIC stands for?
Oh, yeah.
APIC. Oh, yeah. Thank you. The Association of Infection Control Practitioners. I think it's now they've changed their acronym a little. Well, they've not changed their acronym, but they've changed their words because it's infection prevention and epidemiology or something along those lines. But yeah, it's for infection control practitioners in healthcare, and it's a similar association that helps them find their education and needs.
Gotcha. Thank you.
Yeah, I think I think one of the conversations we had early on was, what is our role? I mean, what do we want this to be? And I don't know how long it was after we started the association, but really early on, our mantra kind of became moving preparedness forward. So whenever we decide, are we going to take this on or not? Well, does it move us forward? And when I say moving preparedness forward, I mean us as individuals, right? I mean, the five of us as healthcare emergency managers. Is this going to help Mike do something or learn something or whatever? And that's kind of been our mantra for the last 10 years, and I think it's served us well. We've really limited our scope in terms of what we do. We're not trying to be everything to everybody. And so I think that's been really beneficial. But yeah, it really is. I mean, it's for us, right? I mean, we'll let other people do the organizational stuff, the hospital association and healthcare associations and all that stuff. This is for the professional. So that's kind of the way we started it, and we have not deviated. I don't think, Kristi, I don't think we've deviated from that hardly an inch. And as a matter of fact, we've kind of gone back and forth about whether we should, and we have.
Yeah. Keith keeps us in line. He keeps us on the straight and narrow when it comes to when we do whatever project that we are asked to do. He always brings that back to, is this going to move preparedness forward? Is this going to move this professional field to a place that's better than it is now? And if the answer is ever no, we're out. We're not going to pursue that. We have limited resources. We're, nonprofit. We don't have any, grant funding or any big money that is helping pay the salaries. As you could hear, we both have our day jobs. So this is one of those things that, we have to choose the things that are going to move this field forward. And it has to be very measured and right in line with what we need. Mm-hmm.
And yet you guys were able to, because we were talking a little bit earlier before we started recording, you guys were able to grow the association to, 600 plus members, which is really impressive. There's associations that are a lot bigger, but just for emergency preparedness people, it's hard to reach out to everybody. You've done a nice job across the nation at reaching out and getting more and more people involved, from East Coast to West Coast and down South and everything. And I've seen that at the national conference where Mike and Chris, I don't know if you remember, but I questioned sometimes the logic of these two because they did let me present at one of their national conferences. And that was a bad, they made that mistake once. Yes. Yes. That was
They learned too. But it's an evolution.
Not true.
Some great people from all over who are brought together in emergency preparedness because Kristi, you're right. There isn't much out there for us to grab onto to learn from each other, and that's why AHEPP plays an important role, I think, in what's going on. So tell us, because I know
I pushed so hard.
Yeah.
Just sorry to interrupt, but that's why I pushed so hard to get people interacting together. And one of the things that we do every month is collaborate with colleagues, which is basically a Zoom call. Get on the phone, talk with your peers, tell us what your questions are, help solve each other's problems. We're all trying to solve very similar problems. But in the beginning of that, before that was happening, I was getting phone calls. And I was feeling like I was at a switchboard. I mean, I was getting emails and phone calls constantly. Do you know someone? Do you know this person? Can you connect me with this person? Do you know? And I loved it. I was so happy to do it. And yet I knew if there were that many people that actually had my phone number, kind of scary. There were just at least 3 or 4 times more that didn't have my phone number and weren't getting connected to the people and the resources they needed. And so that's where I was really pushing hard for this, because I knew there were so many opportunities to connect those folks. And you're right, Al, we've got people from all across the country. We've got a large group from Canada that has been very, very active.
Yeah.
And one of the things that I push very hard every time we do our conference is we do we start with collaborate with colleagues. And I know that's kind of a buzzword, but it means something to us at AHEPP. It is a push to get people talking. In the first 2 hours of the conference, we want you to sit down in our conference and we want you to meet 10 new people within the first 2 hours, so that every single person in that room is starting to collaborate on something. They are starting to learn new names. This business is not what you know, it's who you know, 100%.
Yeah, absolutely.
And
So
that's how we do it.
So I had a question. So I think I went to your first conference over there in Nebraska, if I'm not mistaken.
Oh, yeah.
And I know you had some of my colleagues from the biocontainment community, I think, presenting that day. So I brought my infection control lead over with me, and she's now like one of the big wigs at Apex. So it's, she's moved on. But at any rate, that's as far as I'd ever gotten involved with this group. And unlike Chris and Al, I haven't been as familiar with your group. So in a nutshell, you're starting to give me a picture of what this group can do for people. So in a nutshell, what is it that you offer? You offer an annual conference, but how do you deliver on this mantra of trying to help people? What products, what resources, what are you putting on the table for people?
Yeah, so our overall kind of mission is professional development for healthcare emergency managers. That's, if I had to do like nutshell, like you're talking about, that's what we're talking about. So we're talking about skill development, knowledge development. We have the conference, we have the monthly collaborate with colleagues, which I describe that as a monthly water cooler conversation, right? You just log in, you chat. We had several questions at this last one about, and people chimed in and if they had an answer. And so that it's that opportunity to just chat about multiple things during the hour and not have an agenda, and we don't record it, and it's whatever the resources that are shared on that in that hour is astonishing. So and then we also do just a regular educational webinar every month, which is we just had one recently on it was an active shooter webinar with a gentleman from Texas that was outstanding. And as a matter of fact, we're talking about how do we distribute that to more people, because we've had several people say this is really good and your members have access to it, but the rest of the country doesn't. So we're trying to figure out how we're going to do that, how we're going to distribute that to other people.
You tell them become a member.
I do
I like
that.
you, Al.
Yeah, I'm the how do I describe this to other people? I'm the cheap bastard in AHEPP. So if you want our stuff, you pay for it, and
Right.
I'm okay with that. But there's some stuff, and Kristi actually says this. She talks about this quite often. That she says she sometimes feels guilty about. We have all this great stuff. We want to share it, and absolutely, we want to, and when we can, we do. But so it's those. We've also got just a website where Kristi actually worked with what we call a team. What we call a team. Because I came up with that phrase. That's unique to me, apparently.
Nice.
God. Are you guys sure you want us on here? Are you
No,
positive? Because
we're
it's
editing
not too
this
late.
part.
We can
Keith,
always
we're editing
we can
you.
always not publish it.
Yeah. Oh no.
Yeah.
People need to know I'm an idiot. That's just fine. But no, she's working with this tools and resources team, and they actually, one of the things they wanted to develop was a job description. It's like, what the heck should a healthcare emergency manager's job be? Which is a great conversation to have, right? And it's not
Legit.
going to be the same at every
That's
facility. Yeah,
legit.
absolutely. It's not.
Yeah.
Not going to be the same. It's going to vary. But what are those kind of core things that we think that person should be able to do? I don't know if anybody's really had that conversation before. So
Well, and that, I don't know if you remember, but that actually came out of a conversation from Collaborate with Colleagues, because people's jobs after COVID were getting cut, and
that's right.
administrators didn't know what their EM was doing in their healthcare facility, and so they were cutting their jobs. And so this team, and we form committees based on interest, and we engage our membership. We're not forming committees like by plucking people that don't want to do this. We ask for applications, and we want you engaged. And so this committee was formed. We've got a team of just awesome people that are coming up with some really cool stuff, and a lot of times these tools are just things that they're bringing to the table that they use at their facility, and they want to share them. They want to say, here, this is really working for me. Can you as a team take a look at it and see if it's worth distributing to the rest of the country? And that's where we end up adding those tools. Sorry, Keith, I interrupted you, but
no,
I wanted to
you're
get that
fine.
background in there.
No, and then there's probably two other big things that we're doing. Well, three. One is we created some professional standards, right? We created here's kind of a knowledge package that we think healthcare emergency managers need to have, and that is nowhere near done. We did version 1. We're starting on version 2 already. It's going to be an iterative. We're going to keep developing that. And then next is we're actually starting this pretty soon. We're going to do a salary survey of what are healthcare emergency managers across the country, what's a benchmark for salary, for size of institution versus geography. We're actually trying to pull some information out of that in terms of how many beds should an emergency manager be responsible for. I mean, there's critical access hospitals, which is, I get that. Yeah, I know. That's how do we do that? What does that look like? That's a big question, I think, for our field that we're going to try and answer. And then the last thing is that certification piece, that there are certifications out there, but we're basing ours on those professional standards that Kristi and I didn't sit in a room and pull those out of our head. We had to put together a group of really smart people, and they said, here's what we think healthcare emergency managers need to know based upon our experience. And so we're tested it. If you know that information, then we'll certify you. So it's pretty standard professional association stuff, but we're incredibly engaged with the membership on it.
Well,
yeah, I think most of what we do is driven directly by people that are actually filling these roles in hospitals, and I think that's a difference between a lot of offerings that are offerings from other places for this same audience. These are the people that are doing it, and they're saying, this is what we need because this is we're doing it.
And you guys talked about your AHEPP certification, and Mike and Chris and I, we've all had other certifications. Some of them are okay, some of them are once and done, check the box, put some letters behind your name type thing. But honestly, when I saw the AHEPP certification and just the preliminary things coming out, I went, wow, you really have to work to become certified, which is a good thing in my mind. It
Yeah.
is not a once and done. You have to prove knowledge, you have to go through testing, and I want you two to explain it a little more, but I looked at it and went, wow, it's a multi-phased approach where you work on this. It's kind of like classes. You go to this class and you learn things and you take the test and you're done. Now you move on to the next class or the next phase, and you become better and better, which is really exciting. So, honestly, for you two, I'm glad I'm out of it because I'm not smart enough to pass. I don't think I'm smart enough to pass all your certifications, but I think with your training and the way you're going through it, people shouldn't be afraid of it. They should embrace it and just say, it's going to be some work, but it's going to be worth it in the end. That's my little 2-cent evaluation.
So if I can kind of insert an addendum to what you said, Al, and also AHEPP there's not one kind of member, right? It's not like a full-time emergency manager in a hospital or public health. You have everything. You have folks from critical access. You have what can you speak briefly to the just demographics of the organization? And then, because I think we want to look at and talk about professional standards, we might have given short shrift to the fact that your website has a ton of resources parked on it, that if you're a member, you can go out there and you can get exercise templates and you can get past recordings. And Kristi, is the cost to be a member annually, is it still 185 or something like that?
Yeah, it hasn't
What a
moved.
bargain. What a bargain, right? $185,
Yeah.
you have access to all of that, except for the conference, and you get a discount to the conference. So there's a lot of stuff there.
Yeah.
But yeah, speak to your demographics.
Yeah. So before you do that, we've charged $185 for 10 years, which is killing Heath, by the way. Just so you know, this is one of the things that we need to have a serious chat about at some point. But yeah, it's been the same for years. And go ahead and answer the question, Kristi. Sorry, I jumped in there.
No, you're fine. So demographics, yeah, we have a little bit of everything. We have public health, we have large hospital, we have critical access hospital, we have system hospitals, we have administrators, we have nurses, we have a lot of physicians, we have a lot of folks that found themselves in emergency preparedness because they were in security one day and were asked to do it. We have just a full gamut. It's really cool to go to a conference and see the variety of people that fill those roles because it is incredible. We actually had 3 people, physicians that came from Singapore this year to our conference. And at the end said, they're going to do everything they can to be back because, they felt it was that helpful. And man, what did they say that was, like a 20-hour flight? And that's,
yeah, it's bad. It's bad.
Let's go to Australia too. Why not?
But we have people from everywhere and everything. There has been at one point some discussion and a little bit of push for us to, move into the world of public health a little bit further. We kind of pushed back on that, and our advisory board has pushed back on that, saying there's a place for public health. They have their own group. So we don't need to get into that world. Let's stay focused on healthcare. And so that has been our focus since the inception, and we aren't really going to sway from that. But Chris, you have a good point, putting forward some of the other resources on our website. Yes, the webinar recordings are huge. It just goes on and on and on. On my list of things to do is someday I'd like to organize those a little bit better, but you can basically read a book of all the webinars that we've ever offered since 2014, and they are accessible, all of them. As long as you have a membership. And we also have some, and I don't know how involved you've been recently, Chris, but we've got some more interest and engagement in our discussion boards. And so we have a lot of discussion that is happening. We have discussion boards that are specific to a variety of topics that you can jump into. But then we have this board that is something that was new software with our website that to me, I compare it to something like Facebook. I mean, you just go in there and throw your question out to everybody that happens to be on the site, and everybody can answer. And it's really cool. You can attach documents, you can share things. So
Wow.
that's quite an opportunity as well. If you don't want to do any of that live interaction and peer-to-peer sharing, you still have the Facebook or the discussion boards, and yeah, we have a lot of resources on the website that we continually hope that we're continually trying to meet the needs of people. And when people reach out to me and say, "Hey, Kristi, I found this really cool whatever, I think that we need to share this," I do. And then I put together every 2 weeks a newsletter that alerts people to things that are happening with AHEPP and things that are happening with AHEPP members affiliated organizations. Because I just the other day had somebody from Southern California that reached out and said, "Hey, we're doing this cool CISA thing and for cybersecurity in the hospitals. It's free. It's Zoom. We'd like to invite people. Would you mind putting it in the newsletter?" And absolutely, 100%. Free resources it should be shared. We absolutely need to be sharing those things. And so I try to make that newsletter as robust as possible too. So.
And Chris, I think one of the things in terms of audience, I mean, we're primarily hospital now. I mean, if I had to pick a largest percentage of our membership, it would be hospitals. We really feel, and we're trying really hard to break more into like long-term care. I think if COVID taught us anything, and I'm seeing nods from you guys, yeah, I think we all know that that's a world where, man, these people are talk about other duties as assigned, and they need a frickin' life jacket thrown to them every once in a while because they just have a whole bunch of stuff on their plate and no background, and they need help. So we're really trying to reach out to some of those organizations, and it's tough to break in there. As a matter of fact, I think I'm talking to a group on home health in the fall, and I'm just stupid excited about it. I mean,
absolutely. We've had a recent discussion with some other colleagues about this whole issue, and hospitals need long-term care. Hospitals need home health. Hospitals need a great relationship with dialysis centers and things like that, because when it comes to, decompressing a hospital during a disaster, you need all of that stuff. And they're all required to have a certain amount of emergency preparedness now anyway through CMS and whatnot. Yep. So you guys reaching out to those folks makes perfect freaking sense.
Yeah, I hope so. It's a tough nut. That's a tough nut to crack. I don't know about what you guys' experience was when working, in the hospitals, but boy, they are running on a shoestring for one thing. Mm-hmm. So anything else you throw at them is bottom of the list, which I get. I don't blame them a bit, but yeah, it's just tough to get into that audience.
Yeah. Finding and working in our local coalitions, the folks with long-term care, there's a big interest, but budgeting it and with the regulations they already deal with and so on, it seems like I'm sure they're approached by a lot of folks and it's hard for them to pick without experience what are the best resources. But again, what you've already done speaks for itself. It's just a matter of getting an open ear. So wishing you well in that fall conference.
Good. Thanks.
Thanks. We are hoping this upcoming year that we're going to be able to add a pre-conference session that is meant for long-term cares. And it's going to be in Orlando, home of every retiree I know. So
except for us three. We're still in. We're not there, man.
In the Midwest.
It sucks. Yeah. We're in the Midwest.
Yeah. Hey, you know what though? Would be great is if you could. Maybe you're thinking of this, already done this, but a mentorship or a way of helping hospitals collaborate. The toolkit or whatever. I'm sure they're the tools and the connections are there, but maybe having them be ambassadors towards that. I think we've seen in our coalitions there's, the big four, right? The ones that were originally funded and anointed for the coalitions haven't really opened the doors in a lot of places to the big four, meaning, public health, EMS, county emergency management, and hospitals. But gosh, like you said, we learned so much about the needs, and need to figure out ways to fill that. So great job. Again, you guys are visionary and working in that direction as well.
Yeah, we're trying. I mean, I think if you've taken nothing else away from this time we spent together, this is more of a labor of love than a job. I mean,
Yeah.
it's something we're really excited about, and it's important work.
Well, the way that you guys, the way that you stay connected to it too, because there are some great resources out there. Federally, there are some great resources, but they're kind of repositories. And, I know you both are really interactive and engaging people to figure out, it's one thing to go into a library and try to figure out where a book is. It's another to go in and ask a librarian, and they point you directly to what your needs are and help figure that out. And you guys can help facilitate that with all the resources that that's really great service.
Yeah, and
That's
by the way,
funny
here's a section of the library that you might be interested in based upon your question. I mean, it's one thing to just Google something and come up with a document. That's great, but man, being able to talk to Chris and say pick his brain, and we actually have a mentorship circle, and I find it fascinating that. And this is indicative of, I think, the people in our field. We have a bunch of people volunteer to be mentors. Very few that sign up to be mentees. So, isn't it? I think that's fascinating. That the rookies really don't know that they need one, and those of us that have been in this world for a while, you need one. I can save you. I can save you from making the 400 mistakes I made. And I'm willing to tell you about it. I know I made them. I don't think you need to make them. And I think that's another thing that Kristi and I really try to do too. Is it's like, God, there's so many lessons out there. This is my personal bugaboo. Ready for my soapbox? Okay, here we go. I don't care if you're ready. I'm going to talk about it anyway. So there are literally thousands of after action reports written every year in hospitals and long-term cares and you name it. And we have absolutely no way to gather information from that rich data. There's got to be a systemic issues that we can fix for everybody. Mm-hmm. But all of these after actions are my facility, my lessons, my stuff, and I get some of that's proprietary and you don't want to share some of that, but even the stuff that people are really happy to share, boy, we don't know what it is. We learn things one item at a time instead of being able to look at this universe of information.
I wonder if you guys could facilitate the use. I mean, let's look at AI. Okay, could you somehow empower the system to use AI to do exactly, Keith, what you just mentioned? Be like the supercomputer database of after action reports or something, So who knows? Maybe something like that could be done, and you guys could pioneer it. How's that?
Yeah, Mike, there's a guy in Omaha named Brian Smith who works for I think it's a Methodist, and I'm going to throw his name out there, and I'm going to generate a whole lot of emails for him, and he's going to choke me when this gets broadcast. But he's actually working with ChatGPT, and what he's done is he's found a way to upload like his community plans. It's almost, and this is. You know how much trouble I had getting logged in today, so you know exactly what my tech level is. Ready? So he's found a way to upload his community plans into almost like a neighborhood within ChatGPT. And then, so he's got your county LEOP, he's got your hospital plan, he's got your public health plan, he's blah, blah, blah. All the stuff is in there. So when he says, I had a chemical spill on 64th and O, who do I call? ChatGPT will scan all the plans and say, call this person, this person, this person. What's my radius? Chat GPT. It was an organophosphate spill. What should EMS be aware of? Chat GPT will scan the plans and then outside stuff and said, this is an organophosphate. If it's a gas, you have this big a plume area. What direction is the wind from? The stuff that AI is able to do is astonishing. We ran a full-scale exercise today and generated 175 patients with AI. You guys have run exercises.
Yep.
That's a nightmare.
Yeah, man.
Creating
Yeah,
patients.
Yeah.
And he did it half an hour. He had 175 patients with blood pressures, genders, names, whole 9 yards.
It's powerful.
I'm this far from being out of a job.
That's powerful.
Yeah.
I've seen even know that.
2 people are working on AI.
Look what we've done here.
Tabletop exercises with AI too. Yeah.
Yeah.
So AI with the exercises, but I think as you mentioned, really having that assistant that nobody can afford to help you, instantly calculate all that stuff. That's definitely if they can figure out the security for it too, right?
Yeah.
Right.
Yeah, that's the hard thing. And I actually come from a past of working in patient safety too. And so when I was working in patient safety, they had all these patient safety initiatives, and they had the group that basically allowed for you to send them all of your RCA, root cause analysis, and whatever it is when you were analyzing the never events or near misses that happen within a hospital, because there's always those things, and it's never a person, well, hardly, very rarely a person wanting to harm another person. It's usually a process. And so patient safety has this down. They have the ability to upload these documents, and it is protected from legal consequences. It's a big deal. And they, as long as you are part of this group and then this group can kind of mine that data and send out to the rest of everybody, hey, don't pour alcohol on a patient right before you're going to use cautery because you're going to light them on fire. Those are the things that we did back in the day of patient safety years and years ago. But we should be able to do that with disaster preparedness as well. I think it aligns well. The process makes sense. There's no reason we couldn't do that. So yeah, I'm right there with you. I think we should start mining this data. AI could help us. Not to be confused with Al.
Yes. Yeah, that's right. That's right.
Al is AI.
Who's confused
This is
by
not
himself.
Al. Al is not here. He's on the golf course.
Yeah.
That's same thing.
Right. That's
this
AI,
is an AI
right over there,
fake
not Al.
Newton
That's right.
of your imagination right here.
Yeah.
And the fact that you're mentioning it, the fact that different people are starting up projects like Keith mentioned, again, it makes sense to have people work together or to feed information from, those that maybe can't do the AI to give them the raw data they need. And again, we need some networks to plug into, and AHEPP is one of those where the phone call or the collaboration with colleagues or the conferences are where things are going to move forward.
Yeah.
Mm-hmm.
Yeah, I mean, I love the fact that we are in this world right now of being able to do this that we're doing right now, right? I mean, we can get 5 of us basically in a room and share ideas, chat, pick things apart, agree, disagree, the whole 9 yards. But to Kristi's earlier point, one of my favorite parts of our conference is that collaborate with colleagues. Where and I know that we force people to interact. Kristi, I should say, forces people to interact. This is her. By the way, if Keith ever says anything bad about collaborate with colleagues, you'll find my body in a ditch somewhere, because this is Kristi's baby. She came up with it. She pushes it. She does it every year. And I know all the introverts in the room are throwing up in their mouth a little bit when we start talking. Oh, you're going to have to talk to people. But man, is it powerful. And that I love this, don't get me wrong, but man, that sitting down and breaking bread with people, that makes a difference.
It's the only way to
so
do our
much more
job.
likely.
It's the only
Yep.
way to
We've
do our
had
job. And
so,
and
yeah.
unfortunately, COVID screwed us up because that is the way we all operated, is face to face. We met monthly, face to face, our
Yep.
groups.
Yep.
And that's how we did our
Yeah.
best collaboration. So Kristi, this thing is absolutely essential. Doing your job face to face with other people that do your job is the way to do it.
Yep.
And, we've had so many requests from people saying, budget doesn't allow me to travel to the conference. I want to be at the conference. Can you offer virtual? Is there a virtual option? And I appreciate that. I so very much appreciate that request. And I am not discrediting it in any way. That need is there, and I understand that need. But I do not feel that adding a virtual component to the conference is going to add to the conference in a beneficial way. We already offer virtual education monthly. We already offer virtual networking monthly through the association. And that conference is our one time a year that we have an opportunity to be face to face and troubleshoot and converse. And as Keith said, break bread. I would say, have a beer together and just
Beer
get
summit.
a chance to really talk about what's really going on and what are your passions. You don't get that in an email. You don't get that passion in an email. You don't get the passion in a conversation online. The only way you can really focus on what those needs and wants and hard places that you're getting to is in person. And so, again, I want to be the whatever everybody needs all the time. But I just can't justify watering down the conference when we only get a chance once a year. And so we'll keep doing it in person, and we'll hope for the best that facilities are willing to fund this and help their folks become more knowledgeable and more connected within this world. And I do think that after some time goes by, even though COVID wrecked us when it came to allowing for people to go travel for work, I think we'll get back there. Maybe not to the capacity that we were before COVID, but we're seeing it already. There are more and more people that are attending in person at the conference, and they are there to gather up information. They're there to network. They're there to do everything that they used to do before COVID and learn from each other. Our presenters are great. We have presentation abstracts are open right now on our conference, so that sometimes makes it a little more affordable if you happen to get selected by the planning committee. This is not, don't start sending me stuff. Don't butter me up. I don't make these decisions. But if you are selected by the planning committee to speak at the conference, that you get a free registration. So that covers part of the cost. So there are ways that you can get involved with AHEPP without having to pay exorbitant fees. One of the benefits of being on one of our committees is you get a year's membership paid. So if that's the only way you can do this, then that's the only way. We're happy to help with that. We don't allow non-members to become committee members, so we have a chicken and an egg situation. But if your company has already sponsored you to go to the conference and you're already a member this year, but you're going to struggle next year to get funding, join a committee and we'll cover it for you. Join a committee before your membership is up. And so we have a lot of options and opportunities to help people succeed in this world.
Hey, Kristi, when is the next conference? What's the date? Do you have it already?
Yeah, it's February 27th and
24, 25, 26.
Oh, thank you. That was
24th and 26th.
Thank you, Keith.
And we just have a handful of minutes left here. I need to steer back to Al, who I rudely cut off on talking about professional standards, because that was a lot of work, and it's thing in progress.
Mhm.
As previously mentioned, there's a couple of other certifications that are out there, but this one is kind of created by the latest and greatest shakers and movers in the industry. Can you talk a little bit more about that? I know, Al, you've had some exposure presentation to the presentations about this. So if you want to kind of manage those minutes for us.
Yeah, Keith.
So
Yeah, Kristi, go ahead.
yeah, so if you're curious about how these standards were put together, how this certification is put together, we actually have a 1-hour webinar listed on our website, and it's free. It's open access. So if you really want to know the down and dirty details of it, feel free to hop on the AHEPP website and just check that webinar out. But basically, we put a team together of very, very experienced individuals, much smarter humans than I am, that put these standards together and determined what it really is to be a healthcare emergency manager. And I'm sure that you all can attest to this. It's a different beast. It's different than government. We're not funded in healthcare like government agencies are. We're not funded like a private business either. And yet we kind of are. And yet we're also required, we're held to CMS standards. We're held to EMTALA. We can't refuse patient care. And yet it's complicated. And so that means that healthcare emergency management is complicated. And so we thought it was very important as we developed these professional standards to really have the individuals that were in the field of healthcare emergency management drive that conversation, drive those professional standards. And like Keith mentioned earlier, everything within our certification is driven by the professional standards. And then forward thinking, the professional standards are not done. Yes, we have a document. You can read it, but they're not done, and they never will be. We're going to continue to review those. We're going to continually put committees together, and we're going to add to those. We already see, 15 more in addition to our 14 that we have right now, standards that need to be added. Because 4 years ago, when we started developing this, cybersecurity was just something IT did. And now it's not. Now we have healthcare emergency managers need to be involved because holy cow, it's affecting patient care. It's affecting nurses. There are things that the healthcare emergency manager needs to be involved in as well. So that's just, what we need to do is continue to update and continue to provide those resources and make sure they're current.
So you've got standards, but you also have kind of the pathway to understanding and kind of being credentialed in terms of the regulatory bodies. You mentioned CMS, but there's the National Fire Protection Association, and there's OSHA. And I think when people get into this business, it's like, well, where are the boundaries of knowledge that I need to know? And that's really what you guys are helping stake out. Is that right?
Yeah, it's kind of a joke, not really, but we're a mile wide and inch deep. 5 years ago, I couldn't spell cybersecurity, and now it's a key component of what our folks do. One of the things that we're considering adding to the professional standards is supply chain management. Pre-COVID, it was on the periphery. Now it's no longer on the periphery; it is dead center, right? So it's as our world develops and our field, our professionals develop, these professional standards are going to grow and grow and grow, and it's to what extent do we? Two things. One thing is, to what extent is cybersecurity our gig, right? I mean, it partially is, not all of it. Some of it is. Which parts are, which parts aren't, and more specifically to us, what do our folks need to know about it? What is that knowledge base we have to have? Do we really need to know how AI works? Probably not. Do we need to know how it's going to affect direct patient care in this room? Probably. It's weird. We had on one of our Collaborate with Colleagues, one of the questions that was brought up was, does anybody have any plans for lithium ion battery fires? And we're like, what the hell is that? What are you talking about? What do you mean? And now it's a thing, right? It's this
it's
thing,
wicked.
and it's
yeah.
it affects what we do. It affects what bikes do we allow in the building? How does this affect our equipment? So that's the kind of stuff that we're getting from you guys, right? Kristi and I can know this much about, but man, you guys are in there. We need information from all of you guys and the members to say this is an issue. How, has anybody dealt with it? And that's what professional standards are.
Chris, to your point, when you bring up NFPA, OSHA, ASPR, FEMA, all of the places that all have a certain amount of information for healthcare emergency managers, that we need to know pieces of all of those things. And so when you look at our documentation, when you look at our requirements for certification, the committee that worked on creating this certification thought it was really important to, first of all, every single question that is on that exam has been mapped out to some document that is within our reading list. We have a reading list of recommended reading list. Before you take the AHEPP certification exam, you should read these documents. Now, to be fair, one of them is NFPA and one of them is OSHA. Those are big documents. There's a lot to it, right?
Right.
But they come from standards that are out there. It's just that we have only chosen the standards that we think are applicable to healthcare emergency management. And again, this was not done in a room with Keith and Kristi in any way. It was everything we did was by committee. We have some amazing engaged individuals that their whole goal with participating in the hours upon hours upon hours that they've spent in Zoom meetings with us is to move the profession forward. They want this certification to be meaningful. Al, it's not easy, but that's by design. If you have HCEMM behind your name, that should mean something big, and that was the goal. So we're excited about it. We have a handful of HCEMMs. So if you see that on their back of their signature line, give them a good pat on the back, because it's a hard accomplishment, and they're doing well. And those are their future mentors. Those are the people that we need to ask to help others.
Awesome. Al, anything in closing, or Mike? Because we have to wrap it up.
Yeah, we'll wrap it up. But I think Mike will put in the in some of the information. But Kristi or Keith, for the listeners who don't watch the podcast but just listen, what is the website that they can go to learn about AHEPP more, to look at some of the things, and to learn about the certification process, so they can go, maybe that's interesting to me? What website are they going to go to?
Yep, that's going to be www.ahepp.org. AHEPP, Association Healthcare Emergency Preparedness Professionals.org.
Very
Perfect.
Good. Easy.
I'll make sure I put that into the video description and have some hot links to you guys.
Thanks, Mike.
Excellent. Thank you. It was great talking to you all today.
Oh, hey guys, this was very, very good. And we hope to have you back sometime, and offline we will talk as well, because we got some things to kind of chit chat about too.
Awesome.
Excellent.
Great.
Yes,
Thank you very much.
That. Thank you.
Thank you, guys.
Glad you guys are
everybody. Just want to remind everybody.
Oh, yeah.
Our email is readiness.rewired@gmail.com. Make sure you click that subscribe button and ring that bell so you know when we post a new video. Please give us some feedback. We want to know if we're giving you what you need, or tell us that we suck. Either way, we need good feedback, and we hope you guys come back and check us again. And so thanks for coming, everybody.
Thanks, guys. Appreciate it.